Hi everyone, my name is Anna Manolopoulos. I'm an orthopaedic surgeon who has an interest in adults and paediatrics. Today I'm going to be talking about hip dysplasia in children. So when you're assessing a child with dysplasia, one of the first things you need to ask about is their risk factors. I've summarised this on a handy little handout that I give my patients, and it has on it the risk factors, which are briefly summarised as the type of delivery, either natural or breech, whether they're firstborn, whether they're male or female, whether there's a family history of any hip dysplasia, what birth order they are, first, second, subsequent, their weight at birth, and whether they have any other abnormalities of their feet or of their spine. This gives them a score relative to the baseline risk of having dysplasia in the community. Once I've done a risk assessment on history, the next thing I'll do is examine them. Now obviously I don't have a baby in here to examine, but I do have a model. Here's a model. So children should be examined preferably with their nappy off. They should be in a nice warm environment, they shouldn't be hungry and they shouldn't be cranky. So the best way to examine a child's hips is to be standing away from them with the hips facing you, with your hands on both hips and knees, and doing a very gentle abduction to feel for any clicks or clunks. Now this is obviously a model, so it's not going to click very well. But what you feel in a child who's got an unstable hip is you'll feel a soft clunk on the side. You might also feel the hip slide in and out of joint. You can also look for things like asymmetry of the creases around the thighs, or any shortening of the leg, which is not present in this model. Once you've done an examination, you can use ultrasound to confirm your findings. We don't have an ultrasound here to show you. If you do find children have dysplasia, the treatment is best instituted when they're little and early. The treatment is mostly bracing if the hip is stable but needs to be covered for a period of time to let it develop. The braces we use fall into two categories. There are the hard braces, like one of these, and the soft braces, which are called pelvic harnesses. These are usually on initially for 6 weeks, and then we check with a repeat ultrasound to make sure the hips are developing, and then are weaned off over the next 6 weeks. If the hips are structurally normal at the end of that time, children are normally followed until they start walking, and generally until they stop growing.